the opportunity, the chance to present just my thesis title, which is entitled by needle sticks and sharp injury, and it is associated factor among healthcare workers in southern parts of Ethiopia. So this thesis is performed by Shegaw Tesfa and et al. So the presentation outline, which is the introduction, methods and materials, result, discussion, strengths and limitations of this study, conclusion and recommendations, as well as lastly, that's the reference of the study. So when you come to the introduction part, just in needle stick injury is an accidental puncture of the skin that's with the medical equipments or any sharp materials that's safe to be considered as needle stick injury. So if you are saying needle stick injury, any sharp materials or any medical equipment when the healthcare providers are exposed for such like materials that is said to be, that is needle sticks or sharp injury. Any medical items such like that of scalps, blades, lancets, retractors, scissors, pins, clamp cuts or staples and glass items when they puncture the skins of the healthcare provider or workers that is said to be considered as needle stick injuries. The healthcare workers are exposed to blood and body fluids through occupational sharps, splashes, and needle sticks injuries at this time. So those injuries are the major cause of bloodborne pathogen diseases. When they are exposing to this injury, healthcare providers are easily exposed for bloodborne pathogen microorganisms. So they may be exposed to bloodborne disease. The majority of the injuries occur during the during or in operational theatering time, and during sample collection time, during medication administration time, as well as it might be during waste disposal time, especially in negligent waste disposal methods. Particularly, there is a potential exposure among physicians, doctors, nurses, laboratory professionals, biomedical waste management staffs. Mainly those individuals are highly exposed to this needle sticks and sharp injury. Most common workplace related health hazard responsible for the transmissions of bloodborne pathogens. It causes substantial health consequences and psychological stress for healthcare workers. A review of study conducted in overall African region revealed that around 51% of the healthcare workers, and in Ethiopia, 43.6 healthcare workers exposed to these needle sticks and sharp injury in course of their entire careers of their work time. The main contributing factor for needle stick sharp injury were job satisfaction, just being as a cleaner worker, working in maternity ward, emergency units, and lack of work experience and lack of training about needle stick sharp injury and safety measure was the main contributing factors that have been identified before this time. While in search, factors like number of working hours, types of instrument, shifting time, and in other activities, beginning of post-exposure prophylaxis after injury, applications of antiseptic agent were not mainly discovered and does not be statistically tested in prior studies. So that is why this study is performed. But identifying this contributing factor is important for effective prevention of needle stick sharp injury in healthcare workers. So this study was designed to fill these gaps, and findings of this result used as an evidence-based practice for healthcare community and healthcare safeties So the sample size determination, the sample size was determined using a single population proportion formula, that is n is equals to z alpha over 2 square pq over, that is d square. So the overall sample size determination was determined by using this formula, that is as the sample size, the overall sample size was 341 using just considering a 10% non-response rate. The third participants was selected using these schematic presentations. That is, the sampling procedure was just, the study was performed in southern parts of Ethiopia, Warabe Comprehensive Specialized Hospital. This hospital contains a variety of healthcare workers like nurses, psychiatry, GP practitioners, specialists, midwiferys, medical labs, anesthesia, public health officers, and cleaners. And from these different stratas, using a simple random sampling, just and proportionally, just a total of 341 sample size was selected. So, which is considered as representatives of this study area. Data collection instrument and quality control. A standardized structural questionnaire was used, that is prepared in English language and translated to the national language, that is Amharic language. And the dependent variables of the questionnaire was the presence of needle stick sharp injury, and independent variables, there are other socio-demographic characteristics variables, needle sticks and sharp injury variables, and awareness on safety measure related variables, which were adapted from previous similar studies, which is performed in other DC hospitals and in Addis Ababa Chikur Ambassa Specialized Hospital. So the overall, the variables and the questionnaires was adapted and modified from those previous studies, and training was given for data collectors and supervisors to ensure its quality. Pre-test was done, and data was submitted timely and checked for its completement, consistency, and clarity. Statistical analysis. Any statistical analysis of the study, just data was coded, entered into data version 3.1 and exported to a species version for for analysis of the study, and a binary logistic regression model was used to analyze this study. The relation was determined by using odds ratio and p-values. 95 confidence interval, an explanatory variable with p-value of less than 0.2, less than or equal to 0.2 was in the binary variable logistic regression was entered into multivariate logistic regression to control for confining variables, and a p-value of less than 0.05 was used to declare the level of statistical significance, in multivariable analysis. Finally, the results were presented in text tables and graphs based on the types of data. Ethical consideration, just National Review Board with ethical approval number of this was approved, and verbal full consent was obtained from each study participants. Operational definition, what means by needle stick sharp injury? Any injury caused by needle or any sharp material that accidentally punctures the skin in healthcare workers in their working area during their entire care of working time, the entire care. Healthcare workers, meaning that participants working in the hospital who do have contact with syringes, needles, and other sharp materials due to their jobs are considered as healthcare workers. When it comes to socio-demographic variables or characteristics and the result section, in the result section, the overall response rate of this study was 90.97, 99.7. So of these participants, or more, around half of them, 51.2, were females, and within the mean age, 29.8 years, with plus or minus standard deviations of the age of the participant, and around 60.9 of them were married, and 62.6 of them were having a degree holder within their occupation, and around 40% of them were nurses, meaning that majority of the participants were nursing professionals, and one-third of the participants have more than 40 working hours per week, and around 87.6, majority of them had working experience of less than 5 years, and only few of them, 12%, have had a working experience of 5 up to 10 years. Of the total of 340 healthcare workers, just when it comes to the overall prevalence of needle sticks and sharp injury, of the total of 340 healthcare workers, only 104, or that is 30.6%, were faced needle sticks and sharp injury. Needle sticks and sharp injury, which is just in line with the confidence intervals of from 25.67 up to 35.5%, 5% with 95 confidence interval. And from this, just around 25% of them were experiencing injury up to 4 times within their career time, and around 70.9 were superficial injury, and from this 90.1 was injured by a needle hollow or needle sharp materials, and 8.5 injury occurred during recapping time, and around 4.4 of the instrument had to blood on it during the times of injury, and 67.4 injury occurred during the time. And from this, 36 points of the injuries occurred in wards or inpatient admission in wards, and 27.9 of the participants washed the sites of the injury with soap and water. And from this, only 8.5 of the participants was reported their injury immediately to the health facility management. When it comes to the safety measure taken by the healthcare workers, just around 41.8 of them recap their needle, and around 60.8% recap needle always, and 25% was recap the needle just seldom or rarely. And from the overall prevalence, just 177 or 52.1% didn't receive hepatitis vaccine full dose from the injured individuals. And from this, 67.6% trained on safe practice of needle sticks and sharp injury, meaning that majority of the healthcare practitioners who are participated within our study was took the training on about safe practice of needle sticks and sharp injury. When you come to some of the variables or factors that's associated or related with the main dependent variable, that is needle sticks and sharp injury, from this, individuals just being an older age, was statistically associated with being exposed to needle sticks and sharp injury. Individuals being a cleaner, working in wards, working in operational rooms, working in emergency room, working hours less than 40 hours per week, always needle recapping, and individuals who not trained on safety measure was statistically associated with needle sticks and sharp injury. Mainly those variables working in emergency unit was highly statistically associated with needle sticks and sharp injury. That is meaning that just working in emergency unit was 5.7 times highly associated to or highly exposed to needle stick injuries than just working in other units. And relatively, individuals who are not trained on safety measure was 7 times, just almost 7 times, highly exposed to needle stick sharp injuries than those individuals who have taken the training on safety measure and needle stick sharp injury. So when you discuss our result with other study findings, in this study, the overall prevalence of the needle sticks and sharp injury was 30.6%, which is in line with 26 up to 34, meaning that this study is relatively higher if other studies are below 26, and if this study is relatively lower if other studies are above 34.4%. So when our study result is 30.6%, so this finding is higher than the study conducted in Saudi Arabia, which is 22.2%. It is also relatively higher than the study reported in Kenya, that is 90%, which is also relatively, this study finding is higher than a study conducted in some parts of northern parts of Ethiopia, that is our zone, that is 80.7%. So this difference might be due to the study designs. This difference might be due to the variations of the study designs. Their study includes just 1 year magnitude, whereas this study includes just the entire career time magnitude. This might be the possible significance difference that might be observed on this difference. That is, our studies included only the individuals who are, our study includes the magnitudes of the needle stick and sharp injury who exposed through their entire career time, while the other studies included only a 1 year needle sticks and sharp injury magnitude. That might be the possible difference. While this study finding is lower than the study conducted in Iran, that is reported around 45.5%. In some parts of northern part of Ethiopia, that is Dessie and Tigray, as well as Hawassa. This variation might be due to socio-demographic characteristics of the study participants and their work experience, or it might be due to the study period. Now advanced health facilities are available compared to the past few years. That might be the possible difference, that our prevalence might be lower than this study prevalences. This might be the possible relatively those studies conducted in Iran, in Desi, in Tigray, and somewhere of Hawassa city was relatively, it is old relative to our study period, our study timing. That might be the possible difference that may show the variations of the prevalence of my study and other studies. The other, when we come to the discussion parts of in variables, just being older age was three times more exposed to needle sticks and sharp injuries than just being relative to young. This might be due to just increasing chronological age, related structural and functional changes in loss of muscle strength, sensory nerve ending, loss of concentration, attention might be the possible causes to being older age to exposed to needle sticks and sharp injury. Just it might be just a possible reason or justification. This result was consistent with the study conducted in Africa, that is in some eastern parts of Africa, Kenya. The other, working in operational theater room was more than 2 times highly susceptible or vulnerable to needle stick sharp injury. Just our study finding showed that working in ORT room more than 2 times highly vulnerable to this needle stick sharp injury. The reason might be due to the presence of just various sharp materials in OR room might be the possible cause for healthcare providers are vulnerable to this needle stick sharp injury in ORT room, which is the same as the reported from just in Africa, that is South Africa, which is in line with the study reported from South Africa. The other, working in delivery units or working in labor unit was 6 times, and in emergency unit almost 6 times, and in pediatrics unit almost 1 times highly vulnerable to needle sticks and sharp injury. This might be due to just the reason might be due to working unit or working on those units, especially in delivery unit or labor unit, in emergency unit, where they are highly risky environment for needle sticks and sharp injury, and overcrowded patient stations are existed on those rooms. This might be the possible reason. Just mostly in delivery units and labor units, there is overcrowded patient station. In emergency or so, just almost there are numerous emergency bed structures, and even just patients might be just they might be lie in the bar rooms of the emergency units. So over there is overcrowded patient in the station, and this might be the possible cause for increasing needle stick sharp injury on this room. And even it might be due to poor equipment and material station in these units may enhance the exposure to injuries. Just mainly just a variety of procedures might be performed in emergency unit and labor unit. So at this time, just there might be poor equipment and material station on those units. So this might be enhance the exposure to the needle sticks and sharp injury on or among healthcare workers. This study finding was mimicked with the study finding from just somewhere in northern part of Ethiopia, that is Bahar Dar. And the other variable, just variables, healthcare workers not trained on safety measure was 7 times more likely to develop needle, more likely to expose needle and needle stick sharp injuries than those individuals who have been trained. This reason might be due to those who are training had a better awareness and have a better knowledge about standard of precaution on needle stick prevention on needle stick injury and its safety measures. This might be the possible justification that individuals not trained on safety measure highly exposed to needle stick sharp injury. This might be the possible justification. This report was similar to a study reported from some parts of Africa, that is Kenya, as well as in some part of Ethiopia, like Dasi Hospital, and some northern part of Ethiopia, Tigray region. So this might be just the discussions of our study finding or other study finding, prior study findings done before this time in a global level. When it comes to the strengths and limitation, just strengths, actually this study has a high response rate and it has inclusive natures, that is meaning that incorporate all healthcare workers, all healthcare or multidisciplinary healthcare workers. This might be the possible strengths of this study. Limitations, the study didn't address qualitative sections of the data, so this might be the limitation. It is the cross-sectional natures of the study, can establish cause-effect relationship. Since it is simple cross-sectional study, it doesn't show any cause-effects relationship. Might be just affected by recall bias because just the data is collected through the based on the healthcare workers recalling the times of a needle stick injuries that happened before. So at this time, just rarely it might have recall bias on healthcare workers. That might be the possible limitations of this study. Conclusion and recommendation. When you conclude, there is high magnitudes of needle sticks and sharp injury in overall in Ethiopia. Actually, just and magnitudes of needle sticks and sharp injury should be just to the maximum potential, should be minimized. And if it is possible, just we may reduce it to 1 and 0. We may reduce it into 0 prevalence. So if there is a certain prevalence, just we may say that there is high magnitudes of needle stick and sharp injury. And lack of training on work-related safety measure, working in different units, especially in delivery and labor unit, in emergency units, in working in patients, like working in pediatrics units and being as a laboratory technicians, cleaners, and contact working hour and needle recapping after use was a significant predictors of this needle stick sharp injury based on our result. So as a recommendation, we recommend the Ministry of Health should provide formal continuous professional development training on safe practice, just based on our study finding. Just individuals who are not trained on safety measures was highly exposed to needle stick injury. So the Ministry of Health should design a strategy for giving a continuous professional development training about safe practice and safety measures for prevention of needle stick injury, which can able to minimize this problem. The other, we should ensure the healthcare workers on safety in working areas. Just we have to ensure the healthcare workers should keep their safety in their working area. We have to ensure. The other, we should also access an adequate supply of personal protective equipment to high-risk working environments like delivery units, emergency units, ORT units, and inpatient units, ICUs, such like. Just we have to provide adequate supply of personal protective equipment in order to minimize the risks of vulnerability or risks of needle sticks and sharp injury on these rooms. So this might be just the possible recommendations that we recommend based on our study finding. Those are the highlight references. So just as a general from our study finding, just we have to be safe, we have to be safe to prevent a needle stick sharp injury. Just so based on our study finding, it describes that just you should try to minimize recapping, just needle recapping after use, because always needle recapping may cause needle stick sharp injury. We have to properly just dispose the used needle stick or any sharp materials such like that. So just such significant variables should be just, we have to give attention for significant variables that related with needle stick sharp injury. This is the overall findings that we have got from our study. Thank you.